I think you're referring to the company called Epicenter, who have made quite a thing about their COVID passes. That they've been telling people that they can have a chip implanted, and it's an RFID, radio frequency ID chip, or a near field communication chip. So it's pretty low frequency, it doesn't travel a very long distance, but it can connect. This is it. It can connect to your COVID pass, or as you said, any other data, any other personal data that you might be using or storing. It's been quite a thing in Sweden for a while. The last data I saw suggested that over 4,000 people had been chipped, and actually there were implant parties that people were going to get chipped all together. So it became a bit of a thing. And as you say, it can give us access. It can unlock doors, whether it's your car or your front door, or it can, as you say, be used on commuting, like if you're using it as your Oyster card. It's not particularly dangerous. There are some risks to it, but I don't think it's exactly the same as a digital ID. I've seen some people worrying about a digital ID. I think that's very, very separate. And indeed, the Swedes have had a digital ID system for about 15 years, I think. So it's not to do with that. It's to do, I think, in that particular culture with the idea that you can store your data, store your personal data, and in particular, your health data in a convenient and accessible and very personal way.